Welcome to the Dr. Lexi Show, where I take pregnancy topics and break them down into simple terms to help you advocate for yourself and your pregnancy. I'm Dr. Lexi, a board-certified OBGYN and maternal fetal medicine specialist, which just means a high-risk pregnancy doctor. And today on the podcast, I have a very special guest, Alayna Ford. Alayna, welcome.
Thank you so much for having me.
Yeah, thanks for being here. So today I'm super excited because we get to kind of talk about your story as a mom of two and kind of go through kind of your birth story. So you have a 13-year-old is the oldest. Okay. So how did that pregnancy go versus your second delivery? Because they were pretty different, I think.
Yes. So extremely different. So I was a teen mom. So that was, the biggest thing was, my age at the time. I feel like you'd think that because you're younger that like your body will just bounce back or, that it can handle kind of anything because you're that age. And I don't find that to be the case, or at least personally. But I got pregnant. I was 15 and I had a vaginal delivery. I pushed for probably an hour and I just felt like he was not moving and it was feeling frustrating. I did have a failed, what is it called?
The epidural?
Epidural.
Yeah.
So I got the epidural and it wasn't in the proper place. So it wasn't administering the medicine to where it should be. It was administering it somewhere else. So following my delivery, it was my left leg that went completely numb. Like I couldn't move it. It was just, and I had like zero motor function with it. So that was a bit terrifying.
For how long?
It lasted about a good 14 hours after delivery.
Yeah.
My mom was getting real worried about it.
Yeah.
So was I, because, I couldn't really walk after.
No. So you felt all of that delivery then because you weren't
100%.
getting the pain control in the area it should have been going to, but then you didn't feel that leg afterwards.
Correct.
That's so scary.
Yeah. I definitely felt all of the contractions, all of the hard labor pains. And I kind of pride myself that I was able to do that. And I actually got complimented by the birthing staff. I delivered up in Prescott Valley, and they had just opened this beautiful birthing center. My room was huge. It was just gorgeous, place. And, now thinking back, I'm like, man, I would have been nice to deliver there again because it was super nice. But the birthing staff, complimented me, and they, complimented my mom and had said, she freaking killed it in there. She did way better than a lot of other women that are, 30 and having babies did. Yeah. So I was, pretty proud that.
How did you do it? Did you feel like I feel like you probably mentally had to prepare for it. Plus you have pain that you're trying to overcome this pain while you're doing it. Did you do anything in particular to get prepared for that day?
No,
just kind of those instincts kicked in and it just happened.
I honestly think back and I'm like, man, I did not prepare for really anything. I was just young and the baby was growing in me and, when it was time, it was time. And, I was going to deliver and it was really just kind of go with the flow. Yeah. And, I didn't really have any major concerns or, my providers didn't really have any major concerns that they shared with me. So everything was just very straightforward. Yeah. But then it wasn't until during that delivery that, I kind of had some issues and then, post delivery, I couldn't, use my leg and, all of those things. But to handle the pain, I kind of put myself into my own little hypnosis state. And that's what at least my mom described because I didn't know this, or it's easy to assume, right? But watching a birth versus going through the birth are two different things. So me, who's experiencing this birth and experiencing this pain, I really just kind of, I don't know how, but I was able to zone in and I kind of almost put myself into this mental state that when I wasn't pushing, I was somewhere else.
Yeah.
And I didn't really have like a designated place I was. It was just my eyes were closed and I was pretending like I was asleep. It was basically what I was doing. And I'd get kind of like that pain again. And like, you know, when you feel that pain of like, okay, I got to like push pain is completely different than like just regular contraction pain. So you get that push pain again. Then I was like, okay. And I'd almost like wake myself back up and then we'd push.
Yeah.
And that was really how I got through that hour because it was a pretty intense hour.
Yeah. But then after the hour pushing, the delivery went pretty well?
Yeah. So after the hour push, I, again, felt him kind of like have that resistance and kind of go back in. And I remember asking my, the birthing team, is he going back in? And they were like, yeah, that's normal. And I was like, no. This needs to like
supposed to go that way. Well, and they do sometimes, like if some people call it a turtle sign, if the head comes out and then when people stop pushing, it goes back in. That can make the delivering team concerned that the shoulders may not come out after the head comes out. And you are a younger person, and younger women have smaller pelvic bones generally, and you're a pretty petite person. So I would have been like ready for that. You know what I mean? Like, and I'm sure they in their minds were preparing for that just in case. Because, if the head comes out and the shoulders don't, then you have a shoulder dystocia, and then that's an emergency. And
if you'd get an emergency C-section if that happened, or how would you tackle that?
When the head comes out, we have maneuvers to try to then get the rest of the baby out. And the first one is called McRoberts. And all we do really is we try to flex at the hips and flex at the knees to bring your knees toward your shoulders. Okay. And so what it's meant to do is take the maternal pelvis and like flatten it out more to allow the baby to get underneath that pubic bone, because it's kind of, the pubic bone's not straight. There's a curvature to it. So we do that to try to flatten out the anterior and posterior kind of length or diameter there. And that usually helps a lot of the times. And then if not, then we do supra-pubic pressure. So we do a little bit of a kind of pressure right where your bladder area is. And then we get into other maneuvers if needed. Because once the head's out, you would like to deliver the rest of the body and not have to do something we call a Zavanelli, which is push the baby back up and go for a C-section. And that's a last-ditch effort kind of thing and is super rare to happen. And then it was how many years until your next pregnancy?
I think it's 7 years. 7. They have a gap.
Okay.
Because he was born in 2017. So, 7 years, because my first one was 2010. And my next one's 2017.
2017.
Yep.
I've always wondered this because you felt your delivery, right? Yes. Okay, because some people are like, I had an epidural, it was great, and I want to have 7 more kids, right? And as the provider, I'm always thinking, when I delivered babies where the moms didn't have any pain meds and that's how they wanted to do it, most of them changed their minds and went for pain meds. Totally fine in their choice. You kind of wanted some and didn't get them, which was not ideal. But I wonder, the pain that you felt during labor, do people forget about it? Like, when people are like, I'm going to have another baby, and they're like, oh, I forgot how much this hurt. Like, I always try to describe it like maybe it's this visceral pain that you only experience it then, and you're never going to experience it again unless you have another kid. So it's like you're not used to it. Like, when we have a stomach ache, we're like, oh, I know that eating this makes my stomach hurt. And it happens so frequently, I'm not going to do it. But it was like, you had a baby once. I feel like there's something with that quote unquote pain that our bodies may forget because we don't have them again. I don't know. Like, were you worried about that in having another kid?
Honestly, not really.
No?
I wasn't really worried about that. I mean, I think it all depends on like the person's perspective, right? Everything is, how somebody is like, how something is perceived. So, and everybody's experience is so individual that, I feel like it would be hard to truly answer, but like from a personal experience, I kind of knew going in, like, it's going to hurt. And I remember that pain. I didn't forget. And it's not something that like veered me away from wanting to have another baby.
You mentioned like you kept saying that your birthing team when you delivered your first kiddo. So was it who was part of your team?
So I didn't have a doula or anything like that. There were 2, I think they're birthing nurses. What is the right word for them?
Well, there's nurse practitioners, there's certified nurse midwives. So maybe it was a nurse midwife.
I think she was a nurse midwife. They were awesome, like awesome team, like super, super sweet ladies. Like they helped me so much and it was awesome.
Nice.
And then the doctor came in like once I was crowning and then delivered him like the rest of the way.
Right.
So it was just like when I say team, I mean just 3.
Yeah. Yeah. I love it. But I like that you had the support during labor too, and you felt that support.
Oh, for sure.
Which is great because I feel like some people don't have that for their birth story. You know, it's kind of
Yeah.
like it can be a bit messy, but yours sounds like, even though it wasn't awesome postpartum with the foot and the leg, right, that it went well. And then for the second delivery, vaginal delivery,
Yes.
still okay. And then how
I had
did
a little bit more of a challenging
I was
one with
gonna
that
say, tell me how that one went down. Still made it to term,
Still,
right, or after
yes.
37 weeks, right?
Yes.
Okay.
So I was after, I think I was 38 weeks.
Okay.
So the day before I went into labor, I got this really bad pain that I had never really felt before. It just felt like kind of like a pop. And after that pop, it was like, oh, this hurts when I'm walking. And I was like, it's hurting more. And then like after that pop, I felt like that kind of hours went by because I was at work when this happened. So I was, and I have a sit down job. So I was working at my desk. There's a team of nurses in the other room, and, some of them come from all different kinds of backgrounds. So when I left for my shift that day, I went to one of the nurses on the team, and I was just like, hey, and I said, can I ask you a question? And they were like, yeah, of course, what's up? And I'm like, I just felt this like really bad pop, and now it's like I feel this like nerve pain that's kind of like running down the front of my like pelvis, and it's like increasing in pain. Like it's hurting to really walk, and it's kind of making me go like, and like when something makes me do that, that's where I'm like, okay, this is bad, because I feel like I have a pretty high pain tolerance.
Yeah.
She goes, okay, and she's like, yeah, does your OB have, like a call line? You can talk to the OB nurse. And I was like, yeah, they do. And, she didn't tell me anything like alarming or anything, but she's like, I would just go lay down, put your feet up, call the nurse and tell her what's going on and, see what she says. And I was like, okay. So I call my mom and, I coordinate with her because I have the other one. So she, grabs Avon from me, and I'm like, yeah, Mom, I'm okay. Like, I think I just need to lay down. Like, it's okay. And time goes on, and, I'm just resting in bed. And then I get like a weird knock at the door, and I'm like, who's knocking at my door? Like, no one knocks on my door. Like, what? So I like try to get up. I'm like a stone.
Oh my gosh.
Like my hips are just like stone to the bed. Can't move. And that made me really freak out. So, I was waiting for the nurse to call me back because you leave a message. So, so I was resting during that time, and she called me back, and right after that, which was good. So she, asked me my pain scale, and I was like, I think I'm at like a 9. And she's like, oh, okay. And then, I told her my symptoms and stuff, and she's like, you need to go to the ER, like right now. And I said, okay. So again, I coordinate that, and we get to the ER, and I show up to the, women's center. There's no wheelchairs.
Oh.
Not one. And my husband like is leaving work to meet me because I tell him what's going on. And I'm like, hey babe, like I've got a situation here, and like I'm gonna be at the hospital, like your mom's taking me, like, and he's like, yeah, I'm leaving. So, he's meeting me. I show up at the hospital, and there's not one like wheelchair. Any kind of movement that like shifted my hips was just
painful. It happened when you were just walking, and you felt like a pop. Okay.
So we get into, I have to waddle my way in.
Oh my gosh.
Jake is like holding my hips. Like that was the only way that I could walk, is if he like kind of stabilized my hips, so that I could take steps. But it was very like small, short steps. So we made it to triage. They like sit me down, and I'm not wailing in pain or anything like that. You're
just trying not to move.
I'm just trying not to move. So I'm like telling them, my symptoms and like what was going on and how it happened and stuff. And there I can say I definitely felt like I was being dismissed.
Really?
100%.
Really?
Yes.
I mean, you can't hardly walk. How is that? I mean, you would think that's not possible because it's like, well, no. I can't walk.
Nope.
Like,
they were just like, yeah, pain's normal.
Really?
And, yeah. And I was like, okay. And I said, but I like can't really walk. And they were like, oh yeah, we put people on bed rest and da 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 da.
Yeah, and better for those listening to, as I've talked about many times before, there is no reason for anyone ever to be on bed rest in a pregnancy, ever, because it doesn't fix the problem.
Yep.
Anyway, go on.
So,
you know this, right?
That's what they did. They put me on bed rest, essentially. But that wasn't until I had to advocate for myself, because when I was there, I was telling them my symptoms. They were being dismissive. And they were like, okay, we've got to just wait until you go into labor. And they were going to like send me off.
So what kind of workup did you get for this? Like, I can't walk. I felt this pop. Clearly I mean, when you say this, I'm thinking of like a pubic separation, like the pubic bone separated, or you have some kind of suprapubic separation of that region. Like that's what sounds like to me.
That's what it was.
Okay.
But I didn't get that answer until I, again, advocated for myself and like demanded to know what was going on. But, they signed me out. And then I went to try to walk again.
Yeah.
And, in that time they were just like, well, we'll just put you on bed rest until you deliver. And there was like zero diagnosis or understanding of like what was really happening.
Yeah.
So, at the time, like you just have so many emotions running through you.
Sure.
You're in pain. You're just like trusting your provider, and like the doctor that's seeing you or evaluating you at that time.
Yeah.
So, I didn't really question it at first.
Yeah.
When I walked out the door, and it wasn't until I got to the parking lot and like had to, when you get into a car, you usually put one leg in and then the next leg. I could not do that. Like any kind of separation was just so excruciating. I think it would probably be on a higher level of like a push pain. Like it felt very strong.
Right.
So like I break down crying in the parking lot and I'm just like, something's not right. Like I need to know what this is. Like there's no way that I can go home and just not know and like feel this way, and that there's nothing that can be done.
Yeah.
So I don't know how I had that strength in that moment, but I definitely did. And my husband runs back to the nurse's station and they're like, we were just here. Like we just walked out to the parking lot and like my wife is just in distress. Like we need your help and we need to figure out what's going on.
So when they let you go from the triage
No
area or ER, right? I'm thinking you had to get out there. Did you get any medicine for pain or any true? Yeah, that's not cool.
No.
Imaging? Did they like? Okay.
They did hook me up. So I was laying in
the
bed,
fetal monitor,
and I was in the fetal monitor, and that was it. But there was no like ultrasound or like anything extra.
See, that's not cool because here's the thing. I mean, like you have pain, right? And had you not been pregnant, they probably would have done more of a workup. But it's like, had you gone into an ER with that kind of acute, because it happened abruptly, acute pain, inability to ambulate or walk, you would have gotten an x-ray, you would have gotten medicine for pain, you would have gotten all these things. And it's never right to be dismissed as a pregnant person, period, and then not be evaluated or treated either.
Absolutely.
Like that ticks me off.
I think about it now and it ticks me off too. And I like it. They totally just shooed me out the door.
Yeah.
That was definitely.
So then what did you do? Because you're 38 weeks-ish. They've told you to go home and just lay there, which is just going to set you up for getting a blood clot, and then also it's not good to just lay there. That's not good for anyone's health or sanity. So you go home because they told you to, right? And you're like, I'm going to listen because it's,
well, I go back. So.
Okay. Oh, so y'all went right back in.
Yeah. So I just got to the parking lot.
Yeah.
And then I'm like, he books it back because he goes back to the nurse's station. Is like, hey, she needs help. So the nurse comes out and she's like, I'm so sorry. I didn't realize, or like she kind of like apologized because like I think she realized that she was dismissive in that moment. So they bring me back and they put me into a different room, and that's when I see the actual doctor. So before I'd only seen nurses, and that's when the actual doctor came in, and the doctor was the one who was like, let me push on a couple places, and they like pressed on my pubic bone and like all that kind of stuff, and they're like, yeah, you have SPD. So it's called symphysis pubis dysfunction, and that's where, like, from what it was explained to me, correct me if I'm wrong, is like your body creates this like extra hormone that releases kind of your ligaments in a way where it's like that's supposed to be meant for just a like delivery, but your body is like acting too early, and it's creating like unstabilized, you know, movement in your hips, and like that's what causes that like symphysis pain, is that separation.
I have seen it. I've had 2 or 3 patients with it, and they struggled to walk. That I mean, and they would walk with a walker because that was the best way for them to do it. And there's not much to do to treat it, but at least we could identify it, try to help with their pain, give them a little belt they could wear to keep that pubic bone to not move as much, because the more it would move, the more it hurt, right? But it has to be one of the most frustrating things to have. And from a provider standpoint, frustrating to treat, because you can see it on an x-ray. We don't like to x-ray people's near the belly that much. But if you need one x-ray, you're not going to get too much radiation from that one quick x-ray to show you, hey, look, your pubic symphysis region is wider than it should be. And there's probably a separation or a stretch that's gone on in there that shouldn't happen right now.
Yeah, absolutely.
So when they told you that, did they get you some attempts at, and again, you don't have much longer to go, I know, but like any attempts at treatment for that?
Not necessarily.
Yeah.
They gave me a pain med to just like help with my pain that immediate. And then they just said, you know, there's not really much that we can do. You know, again, bed rest is still just the instruction that I was given. And I think they gave me like a walker to go home with, and that was it.
No wheelchairs for you, apparently. They just did not want to have wheelchairs anywhere.
And I even waited in the parking lot for a little bit because I think someone was trying to go hunt one down, and they just didn't have any. And I don't know, everybody was using them.
Oh my gosh.
So that was that first night.
Yeah.
So that was the day before I went into labor. Thank goodness it was just one day.
Right.
We get out of the hospital at like midnight. It's like 1 a.m. So we're all tired. And then they gave me a prescription to fill for like some more pain meds if I needed them. And we get to the pharmacy and they wrote the script wrong.
Oh no.
So I couldn't even fill it. So it was just like things
one thing
just
after
kept
another.
adding, like a stacking, you know. So we get home and I'm just like, let's just lay down. Like I'm ready to just put my feet up and lay down and just like stay still.
Yeah.
That was all I could do was just stay still. So we got what little sleep we felt like we could. And then the next morning, I remember feeling those rolling pains. And once you get those rolling pains, you're like, okay. And for me, it was relieving because I was just like, from the night that I had before, like, I'm ready for this labor. Like, let's go.
And to have had to go in multiple times to have someone listen to you, just, I mean, and then to have the script not be right, and then you probably don't have anyone to call. I mean, who would you call then? Because it's the triage area. Then they're going to probably make you come back to have anything done.
We just went home.
You just went home. Okay, so then the next day you go in, you're in labor. Like you're really in labor.
I'm really in labor.
Yes. Okay.
So I like kind of have those like small rolling pains, but it's very small. And I'm like, okay, I'm trying not to get my hopes up. I hope that this is real. Because I had Braxton Hicks with my second pregnancy. So there were evenings where like I would feel those rolling pains and, you know, they were fake, obviously. Sure. After that night we had just had, I was like, please be the real thing.
Right.
Please be the real thing. So we go a few hours. I take a shower. And then we're like just kind of hanging out on the couch. And I'm like, you know, telling Jake at that point, I think this is real. Like, I think these are real pains. And he's like, okay, cool. So we were excited. We already had our bags packed and like everything we needed. So it wasn't difficult to get out the door.
And when you got there, though, was this pretty seamless?
So I get there and they have no wheelchair again. The next morning, no wheelchair.
You're like, but I got a walker now.
Yep. So I got the walker. I go in and they put you in that little triage room and they hook your belly up and they're like, we just got to make sure that you're like really in labor. And I was like, okay. So they hook me up and, you know, I've got the little mountains going on. And, you know, at that point, they started getting pretty strong pretty quickly. Because with my first pregnancy, I felt like I was like having contractions forever. And I was just like walking, trying to get those contractions to keep going. And like I walked a lot during my first one comparatively to this second one. But I think too, because I had to be so stable, the pain felt worse.
Sure.
And I don't know if maybe my symphysis pubis situation that was going on was also like, you know, increasing that pain, but it definitely felt like it. And I remember, you know, getting back in from triage and they're like, yeah, you're going to put you in a room, you know, the whole thing. So just as the nurse is going to put me on like they finally found a wheelchair after I left triage. They had one for me. Yeah. After all that time. She, you know, is going to help me stand up. And I'm like being extra careful because I can't move my hips.
Right.
So I'm just like kind of tiptoeing around trying to get into this, you know, wheelchair she's, you know, has for me. And she's like, you can't walk? And I was like, no. I said I was here last night, and I kind of just like explained a little bit about what was going on. And she was like, oh, can you deliver vaginally? And I was like, shouldn't you know that?
Well, clearly they didn't even look at your chart or know you very well before they were taking you somewhere else. But
yeah. So, you know, she's like, I'm going to go ask. And I was like, okay. So she goes and asks, and I honestly, if that part's fuzzy, she must have come back and said it was fine because I delivered vaginally. Yeah. I got the epidural, and it was like, oh, I could breathe. Like I felt so much better. I felt like my body calmed down and relaxed. And I feel like that really sped up the, you know, delivery process, because it probably wasn't maybe 30 minutes after my epidural that I was like, I think I'm getting and at that point, it's not really pain. It's like pressure.
Pressure, yeah.
So I was like, I have like pressure. Like, I think I need to push. So the nurse came in and checked me, and she was like, yeah, you're ready. So nice. It was probably like 3 pushes, and I was done.
And I think that you are kind of like part of what I'm hoping I can help people do is like, and you did it on your own, which is fantastic, is advocate for yourself from one pregnancy to the next to kind of say, this is what either went, I don't want to say went wrong, but didn't go as planned. And also whenever you had something like a curveball come in there at 38 weeks, kind of like stand up and say, listen, someone has to listen to me. Yeah. So is there anything, I guess, that you could say that for people who haven't done that or don't know how to do that, like what is it that you think kind of got you there?
I think it's really just, you know, your own body. And like, if you can feel that something is wrong, something's wrong. And you have to express that to the person who's, you know, caring for you, your medical advice, and, you know, and the person that's going to, you know, execute what you need done, because they have that medical training and you don't, but you're just like, this is what's hurting, this is what's wrong. And, you know, I just really encourage, don't be afraid to ask questions, even if you think you might feel like you sound dumb or anything like that. Like, just tell them how you're feeling. Be like your own advocate. You know, that's your body.
Yeah. Thank you for sharing your story today. I'll put links below for physical therapists and information on the pubic symphysis separation, because I think that that's kind of something that physicians aren't really comfortable treating, because there's nothing really, I don't want to say there's nothing to do. There's plenty to do, but there's not something that we can fix it. And so a lot of physicians in particular are then like, well, it's not my thing that if I can't fix it. But doctors can refer you to a physical therapist or to someone else that can help with that kind of discomfort, especially if it happens earlier in a pregnancy. Thankfully, yours happened at the very end.
Yes. Yeah. The day before.
The day before. Okay, yes. Well, is there anything else you'd like to add for today to kind of let our listeners hear anything? And I cannot thank you enough for coming today and sharing everything with us.
No, I just really appreciate that you had me here and we had this amazing experience. I want women to feel empowered and like, you know, set themselves up for success. And I think like, as long as you're curious, you're going to have that.
Yeah. Thank you so much.
Thank you.
Well, we're going to keep being curious and keep trying to expand our knowledge and really work on learning things surrounding this pregnancy space, develop some skills, just like you were saying, really being prepared. And I'll do my best to keep preparing you guys and having an impact, not only on you guys today, but on anybody listening and on people that are looking for future pregnancies or who have been through one and going through that postpartum period. We're here to support you with that. So thank you so much for listening. I'm Dr. Lexi, wishing you a happy and healthy pregnancy.